Okay, this is chapter 4, B1, and we're going to look at drugs. So we're going to look at testing of new drugs when they have been designed and the process they have to go through, and then we're going to look at legal and illegal drugs and the impact on body and society of those. So we're going to start off looking at testing of new drugs. So when new drugs have been designed, they need to be tested. They need to be tested to make sure they are effective, so they do the job that people are claiming they do, but also that they're safe. So we must check safety, very, very important. As a specific example, we're going to look at when that went wrong later on. So the first thing that's going to happen is they're going to be tested in the lab. They're going to be tested on cells, tissues and small live animals. If it passes that stage, and they think the drug is safe to be used, we still don't know if it's effective particularly, but we do know it's safe. It can then go into phase 2 and go into clinical trials. Now, clinical trials happen in two ways. Firstly, they're tested the drug on healthy volunteers, so people that don't have the disease or the condition this new drug is going to solve. If they respond well and there's no adverse effects, they're not becoming ill or poorly, then it will go to a double-blind trial. A double-blind trial is where neither the doctor nor the patient knows if they're taking the actual drug we're trying to test or if they're taking a placebo. So a placebo is maybe a sugar pill, something like that, but it doesn't contain the active drug we're actually trying to test. If it shows that the people who took the drug have made an improvement, then obviously the drug looks like it's going to be effective, so it'll be passed, okay? But obviously all the way through this, they're also going to be looking at safety as well. Thalidomide is a drug that you need to know the process it went through and the problems that arose with this drug in particular. So thalidomide was a drug that was developed initially as a sleeping pill and was quite successful, but it was also then found to be very effective in relieving morning sickness in pregnant women. But the problem is the babies that were born to those women were then born with limb abnormalities because the thalidomide they were given hadn't been tested to make sure it was okay to be used in pregnant women, and actually they found that then the babies born were affected by that drug. So that drug was then banned completely, they weren't allowed to use it. But however, more recently it has been found that it can be used in the treatment of leprosy and other diseases as well, but predominantly leprosy, and that's the one that they often ask you about in the exam. So that's testing new drugs and an example of where the drug wasn't tested correctly and it resulted in some serious consequences. Right, another example of a drug you need to know is statins. Statins are drugs which can lower the risk of heart and circulatory disease. So when you look back at chapter 1 and we talked about being overweight and high levels of cholesterol and that causing heart or circulatory disease, statins can be given to people to lower that risk of heart or circulatory disease. So it's an important drug and you do need to know the name of it. When drugs are misused then, so used incorrectly, we can be talking about legal and illegal drugs. So legal drugs will be alcohol and nicotine, so alcohol in your alcoholic drinks, nicotine in cigarettes. These can be misused, so used incorrectly, as well as illegal drugs, so ecstasy, cannabis and heroin, and all of those can affect your heart and circulatory system. So we know that nicotine can affect the circulatory system, ecstasy, cannabis, heroin can all have a major impact on the body. So these are all quite serious. Cannabis in particular, it does reference that in your specification, just to make sure that you're aware that it is illegal and in some cases it can cause mental illness in some people. That's detailed on your specification, so a little bit more detail there than on those ones there. But overall, what's important that we do know is that legal drugs have a greater impact on health than illegal drugs currently, because more people take legal drugs. So we have more issues with alcoholics, people who are addicted to smoking, than we do with heroin or cannabis or ecstasy. Although these are quite serious, the legal drugs have a much bigger impact because more people use them. So it's just important to remember that fact. So with some of the legal and illegal drugs, what can happen is some people can become dependent or addicted to the drug. So that can happen with some painkillers, but it can also happen with things like heroin. And if someone becomes dependent or addicted to it, their body needs it to function. So if you take that drug away from them, they can suffer withdrawal symptoms without it. And that's something that can be vomiting, high temperature, etc. And it can be quite a violent reaction, but it's called a withdrawal symptom. And then finally, the last little bit you need to know for this topic is how some drugs can be banned by sporting regulations, even though they're completely legal and people may need to take steroids for different things. However, when it comes to sport, they're banned for all athletes. Anabolic steroids is the one that they focus on in particular, because it stimulates muscle growth. So people are not allowed, athletes are not allowed to use it. If they're found to be using it, then they can be disqualified from the event they're taking part in. So that's it on drugs. We've looked at testing of new drugs. Thalidomide is an example of when that drug testing went wrong, but how it can be used now for the treatment of leprosy. And then we've looked at legal and illegal drugs, the impact on health and society, and drugs being used in sport. So that's the end of chapter 4.